Well, Australia's top health bureaucrats have some serious explaining to do. It's time they face the music about their handling of rapid antigen test, or the lack thereof, because what you're seeing play out right now is a disaster. Let's be truthful on this. Whether they like it or not, key chief health teams in the states and territories are largely responsible for this problem. They're largely responsible for testing. And because they have not advised their leaders to order these test kits. There's a catastrophic shortage of these RA test kits right now. And the effects, well, they reach far beyond, frustrated punters trawling shelves at supermarkets trying to find out whether or not their cough is in fact COVID. To date, Australia's response to this global health crisis has been A1. We've led the world in our fight against the virus, bar a couple of stumbles. Gold standard vaccination rates, incredible. World-class PCR testing systems, plus an incredibly low death rate comparatively. But these issues with RA test kits have brought us back down to earth with a thud. We've gone from being gold standard to just being good enough. And our pollies and health bureaucrats only have themselves to blame. Now, this mess could have been prevented. This whole thing could have been avoided. There have been calls for rapid antigen tests to be rolled out across Australia for more than 12 months. It wasn't just the Prime Minister turning up to National Cabinet in November and clanging the tin to say, hang on, you blokes had better start ordering. Nothing like that. Infectious diseases experts have been pushing for the introduction of RA tests. It dates back to December 2020. And I remember conducting several interviews in January last year on the need to use RA tests.
I think more testing, though, is going to be beneficial. I think there's a place for rapid tests to be complementary to the existing testing we have.
Paul Griffin was not the only epidemiologist to say we need rapid antigen test regimes. Numerous private health lobby groups and independent experts met with chief health officers right across the country, including the federal medical team. And I'll speak with one of those individuals shortly on the program. They met with politicians, primarily, trying to explain the benefits of rapid tests abroad and how a stockpile was essential. They've been used overseas since the start of 2021, in some cases even earlier. But the Therapeutic Goods Administration only approved the sale of at-home tests in Australia 10 weeks ago, which prompted the Prime Minister to raise it at National Cabinet. 10 weeks ago. We knew they were effective. Why the delay? We knew they'd help if we had a wider outbreak, like the one we've got now, but the government and chief health officers sat on their hands. It's been the state's responsibility to administer testing. It should have been the state's responsibility to adopt a proactive stance on this. Now, all the advice to invest in RA tests fell on deaf ears. And we know why. The governments of Australia wanted to keep control of daily infections. They wanted to keep control, period. And they wanted to do that through PCR tests because they automatically registered as a tally on the health department websites and on the various apps. Stick with the automatic system, they felt, which tracked daily infections. They couldn't foresee, despite what they were being told, what may have eventuated the next phase, that workplaces and individuals would need a more convenient and faster testing system. Now look where we are. Supply chains have been decimated. We're in the middle of a critical labour shortage. We should have had a stockpile of RA tests ready to go. So where were they? Why weren't they calling for the introduction of rapid tests in National Cabinet? Why wasn't the TGA encouraged to get these units approved much earlier? Why weren't they rattling the cage? We had all the time in the world to prepare for this. We had all the evidence in front of us from abroad. They were months and months in front of Australia. And look where we sit today. We waited far too long to approve these test kits as well, and the mess could have been avoided.